We are live. Thank you. Just checking. Hi, everyone. A very good evening to you and a very warm welcome to the open evening at Herts Essex Fertility. My name is Praveena. I'm a consultant gynecologist and fertility specialist. And what do we have in store for you today? So the agenda is I'm going to introduce you to our clinic. There's a small presentation over the next 30 minutes. There are question and answers going alongside. So please, as we are going through the presentation, which some of you might find a bit more detailed, but generally the feedback is that, you know, the couples and individuals much rather have more details than less. So yes, if you have questions arising, keep posting them on the Q&A link, which has been forwarded to you. And please stay with me till the end. We've got a special offer. And also, we would really appreciate that if you could take a few minutes and give us some feedback, because it plays a very important role in improving these open evenings. I will also take you through a virtual tour of the clinic at the end of it. So once again, a very warm welcome to all of you. So tonight's team includes me, and with me is my senior nurse colleague, Jackie McAdam, who is taking the questions alongside. And this whole thing has been put together by lovely Marna, who is our marketing and wellness head. So here we go. So let's take you through the brief history of Herts Essex. This was founded in 1989 with over 35 years of experience and more than 8,000 babies to our credit. We pride ourselves in being a very nice purpose-built clinic in a beautiful part of Essex. All procedures are performed under one roof, which I think a lot of patients find really useful, be it, you know, just a fertility assessment, be it the actual egg collection procedure. Our lab is associated with this and sits alongside, and then we've got a pharmacy as well. So, you know, you don't have to be running between the pillar and post. What are the services we provide? So essentially, we do fertility assessment, we do gynecological screening, we take you through procedures such as IUI, IVF, ICSI, and I'll talk a little bit more in detail about these. We do additional treatments like embryo biopsy to screen the aneuploid or chromosomally abnormal embryos. We also offer PGTM and PGTSI, which are slightly more sophisticated procedures of embryo biopsy, whereby we can screen out embryos which have got genetic abnormalities. All right. We also undertake egg donation, sperm donation programs. We offer fertility preservation, be it egg freezing, embryo freezing, or sperm freezing. And last but not the least, the culmination of this journey are the pregnancy scans. So we offer pregnancy scans, whether these are pregnancies thanks to treatment undertaken in our clinic, or they could even be natural pregnancies. So what do I mean by fertility assessment? So fertility assessment can be essentially of three types. It could be couple fertility assessment. It could be just a female approaching to find out about her fertility prospects, or it could be a male trying to find out where he stands in terms of his semen parameters. Couple fertility and female fertility involves 2 visits. So in this, we get you to come in and meet the nurse, have a pre-assessment, drop off the blood sample, drop off a semen sample. Okay, and then afterwards, you'll be seeing a consultant, whereby in case of a female fertility or a couple fertility, there will be an in-depth transvaginal scan to assess the pelvis thoroughly, and then we'll also go through the results of the blood test and the semen parameters and come up with a plan to get pregnant. If it's a male fertility assessment, it includes semen analysis. Our clinic does an additional special test called HbA, which is hyaluron non-binding assay, to look at the semen, the sperm maturity, and then this will be followed up by a call with the embryologist to discuss the results. During the fertility assessment for a female, we do a 3D ultrasound scan Okay, and the 3D ultrasound scan is a much more refined technique of looking at particularly the endometrial cavity. We also couple it with some insertion of saline through a small speculum, and this bit is known as saline infusion sonogram. And this, as you can see in this picture here, can highlight anything which is intruding into the cavity, like a polyp or a fibroid, which really should not be there before we undertake an embryo implantation. So it picks up these problems very beautifully so that we can sort them out before a treatment commences. We can also assess the patency. So look at the health of the fallopian tubes by passing a dye through a catheter like this, and this bit is known as the hycosi. Moving on, fit for fertility. As you can see on our website, there's a lot of emphasis given on fitness, because we believe that a healthy mind, body, and lifestyle will go and they play a very important role in optimizing outcomes. So what exactly is, how does the treatment unfold? So it begins with, you will contact the clinic. We will then direct you to the fertility consents portal. Login details will be sent to you. You will complete all the forms online. We will take a copy of your passport, obviously, for the ID confirmation. All the relevant investigations, we will direct you on as to how to do it. We also encourage you to download an app called the Salve app, which is an excellent tool, and a lot of patients love it because it gives you reminders about your medications. It is also a very safe messaging portal whereby you can have questions in the middle of the evening and you are not able to call the clinic. Just send us a message and one of the nurses will help you out with those. So we get you to download that app. We bring you in for a pre-assessment where it's an in-person appointment. You see the nurse. Blood tests are done, and these blood tests are going to look at the ovarian reserve through a blood test called AMH. We also look at the thyroid function markers. BMI is done for both the male and the female partners. It's important, I should make a note that, to commence an IVF treatment, the female BMI has to be below 34 because that's needed for us to be able to provide you deep sedation for egg collection in a safe manner. We also at this appointment get the male to drop off a semen sample so that we can analyze the semen parameters. The next step is, once the pre-assessment is done, we then book a consultation with one of the consultants. So this is generally offered via Microsoft Teams, which works really well. Couples or individuals don't have to drive into the clinic, but we can also accommodate a face-to-face consultation. All right. So what happens in this is that the consultant will go through all your results, will look at your medical history, and at the end of about 45 minutes to an hour-long discussion, we will come up with a bespoke plan to help you get pregnant. Once this part is done, then we have to get a few more steps sorted. So we need to do screening bloods as per the HFEA guidance. Screening bloods are needed for both partners. Okay, so these include tests such as HIV, Hep B, Hep C, chlamydia, gonorrhea. Additional screening for the egg provider, so would be AMH. We need to do rubella to confirm rubella immunity. We also do a full blood count to make sure she's not anemic, and we do an HB electrophoresis to find out if she is a carrier for, say, situations like alpha thalassemia, or she's got sickle cell trait, and so on. The results, so screening bloods are done as close to the start of treatment because these results should be within 3 months of the egg collection date. And these should be done through a UK accredited laboratory. So we encourage you to do them via our clinic. If you must do them elsewhere, we have to be sure that they're within dates and they are through an accredited laboratory. Okay, so I'll now take you through some of the treatment options. So I'm sure you've heard of intrauterine insemination. This is a treatment option which is available to maybe heterosexual couples who find sexual intercourse difficult. It could be because of vaginismus in the female. It could be because of issues with the male, such as erectile dysfunction or premature ejaculation. Also, this is a treatment option for women, same-sex women who want to use donor sperms, and so IUI could be one of the first modalities. What do we do in an IUI procedure? As the name says, we select the sperm, we centrifuge it, we collect the best semen sample, take a small amount of it in a catheter, and then place it directly into the womb near the time of ovulation, thereby maximizing the chances of conception. The next biggie, if you like, and something I think all of us would have heard about is IVF. IVF stands for in vitro fertilization. In vitro means outside the body. So fertilization is not happening inside the fallopian tube, but outside in a laboratory. So what does this, the IVF pathway look like? So essentially consultation done, screening bloods done, we've assessed the womb thoroughly. Yeah, we've got a plan ready. We then bring you with your first period. We bring you for a baseline scan, which happens around day 1, 2, or 3 of the period. And what do we want to achieve in this scan? Essentially, one of the nurses will teach you how to do hormonal injections. So these injections are given on a daily basis for the next 10 to 12 days. And what they are trying to do is to stimulate the ovaries to produce lots of follicles and a bigger number of eggs in a safe manner. That continues throughout, as I said, to about 10 to 12 days to get the maximum number of follicles ready for egg collection. Most of them are quite safe. Most women find them quite, they're quite happy to take these, but there are side effects. So they are known to give some headaches. Some women might find themselves getting a bit more moody. There is an association with breast tenderness, perhaps bloating. In some situations where we've got polycystic ovarian syndrome or we've got a really high AMH, there is a small risk of ovarian hyperstimulation syndrome. So we do our best to select the best protocol to try and reduce the risk of OHSS. Right, so injections have started. We bring you for a scan, so it's a monitored cycle. We bring you for the first scan around day 5. And on that scan, what do we want to see? We want to see these lovely follicles growing. As you can see here, all these dark circles are follicles which are harboring eggs. So we want a good number of these reaching a decent size. All the monitoring is happening through transvaginal scans. We also introduce another injection in the morning, which is called an antagonist. It could be Cetrodide, it could be Ovamex. We've got a few brands, okay? And the intention of giving you that injection in the mornings is to prevent you from ovulating prematurely. The monitoring continues. Each scan will be followed by a consultation with the nurse. So if you've got any queries regarding how to inject, I've got a little bit of reaction to an injection, all these issues will be addressed at that point. Right. So comes the last day. Alongside the follicular growth, we are also looking at the endometrium, so the womb lining, and we want to see a beautiful triple line because we're also wanting the womb to start getting ready to receive that embryo. So the final scan, what we intend to do is we find all follicles are looking nice, mature, ready. The endometrium is looking nice and ready. This is the time we will then give you lots of details and we will place you for egg collection. We bring about the final burst of maturation in those eggs by giving you a trigger. Generally, the trigger is an HCG injection. Sometimes it's a slightly different drug called GnRH analog. Okay, detailed verbal and written instructions are given about the egg collection day. What time do you need to come in? How long do you need to starve and all the rest? And all the rest of such particulars. So on the day of the egg collection, both of you, let's say it's a couple coming in, you're invited in, we take you inside the recovery bay. Baseline observations are done. The male goes away to provide us a semen sample, which goes to the laboratory. The woman gets a chance to meet the anaesthetist. We've got a good bunch of anesthetists working with us. You get wheeled inside the operation theatre. You're put to sleep for about half an hour. One of the operating surgeons, it could be me on the day, for example, I will go and do the surgical procedure, which is the transvaginal egg collection procedure. Takes about 20 minutes, 30 minutes, and after that you're wheeled back into your recovery bay. Okay. Once you've had a nice cup of tea with biscuits, you've emptied your bladder, you're feeling well, then the operating surgeon will come and have a chat with you and we're able to give you the initial egg number. Okay, so generally this day case procedure, you will be in the clinic for about 3 hours and then we let you go home, just take it easy, a couple of painkillers, some antibiotics. And then if you're getting you ready for a fresh embryo transfer, we get you to start taking some progesterone pessaries, which are inserted vaginally or rectally from the evening of the egg collection. Right, now the focus moves into the laboratory, which is where as we say, the magic happens. So what's happening in the lab? So this is a little timeline of what goes on. So the day of the egg collection, we call it day 0, right? That's the day the embryologists, these are scientists working alongside, they want to put the egg and the sperm together, either through a process known as IVF, okay, or ICSI or PICSI. And then 24 hours later, which is day 1, we want to see if they have these eggs have fertilized normally. Once that's over, that's the day you get the fertilization check call. After that, they go into an undisturbed culture. So you do not hear from us between day 2, day 3, day 4. The next sort of meeting would be if the lady's getting ready for a fresh transfer, we get you in for the fresh transfer on day 5. Okay, and that when we expect to see a nice, beautifully expanded blastocyst. We also leave anything which hasn't turned into blastocysts but is showing potential, we leave them another 24 hours. So day 6 is when we have the final check and see how many embryos can actually be frozen, if there are any frozen to be frozen as pairs. So as I said, day 0 also happens to be the day where eggs undergo freezing. So as I mentioned earlier, our clinic offers fertility preservation. Just going to minimize this. Sorry. Fertility preservation. So egg freezing is one of these techniques, okay, whereby you can, if a woman is not quite ready to start a family just yet because of either career or not having found the right partner, she can actually preserve her eggs. HFEA now says that initially we used to freeze them up to 10 years, but now we've got 55 years as the upper limit for freezing these eggs. The younger the age, the better the quality of the eggs, the better the competence, and therefore we encourage egg freezing as young as possible, ideally below the age of 35, but we do them even after that. Okay, so that's the egg freezing. What else is happening on day 0 is IVF. So IVF is if all the semen parameters are looking normal, each egg is now left surrounded by a few million sperms and then left in the incubator to see if each of these eggs is now getting fertilized by the sperm. So this is known as in vitro fertilization. On the other hand, if the semen parameters are not absolutely normal, so there could be either issues with low count, poor motility, abnormal forms, then what the embryologist will do is they will select the best sperm under the microscope and each mature egg is injected with a sperm. ICSI is resorted to where semen parameters are not up to scratch. Either there are no sperms in the ejaculate, so it's a situation called azoospermia. It could be that we've got antibodies which cause clumping of the sperms, and in those situations we have to inject and not leave them for IVF. Or if somebody gives us history of previous IVF resulting in failed fertilization, we resort to ICSI. So this is a video of ICSI, and it's fascinating. And I'm going to hope that it works. Sorry, it is temperamental. What I'll do is we will be sending a link of this and hopefully you'll be able to have a look. So I'm going to move on. Right. So ICSI, and the last procedure I was telling you earlier is PICSI. So if we've done, as I said, in our clinic, we also do a special test called HbA. If that HbA result shows that there is more immaturity of the sperms, then we will do a special procedure known as PICSI, and thereby selecting the best sperms to inject. Right. So as I mentioned earlier, on day 1, what we want to see is a normally fertilized egg looking like that. Sometimes we do have abnormal fertilization as well. So once we've seen a normally fertilized egg, these are then moved into the embryo culture and we don't then disturb them for the next 3 days. Okay, I'm going to skip this because sometimes it does get a bit heavy and I don't want you dozing off. So what happens on day 5? So that's the day we, are going to bring the woman in for an embryo transfer. So the beauty about our clinic is that we offer embryo transfers 7 days a week, Saturday, Sundays, because if that's when it should go in. That's when it should go in. So we don't compromise on that. You'll get an opportunity to see the embryos on the screen before we load it into the catheter and transfer it under ultrasound guidance. We'll get a little picture to take away as well. Embryo Blue is an add-on that our clinic offers, and it is a transfer medium which mimics the condition inside the uterus, and there are studies supporting that it improves implantation rates. So that's something you can opt for. Talking about PGTA, like I mentioned, these days we know that most embryos which are going to either successfully implant or go on to give us a nice ongoing pregnancy, a live birth, usually have a good normal chromosomal complement. So the ones which don't are the ones which are responsible for the negative cycle. So these days we do offer a technique called PGTA, whereby we can deselect the aneuploid, that is the chromosomally abnormal embryos, and thereby optimize results. So we know there is data now supporting that PGTA decreases the time to pregnancy, and it significantly drops the miscarriage risks. It's still not 100%, but there is a big jump from when you compare it with untested embryos. We also have the ability to offer PGTM and PGTSR. So PGTM stands for, biopsy for detecting monogenic diseases. So it screens for single gene disorders such as cystic fibrosis, BRCA1, 2, Huntington's. There's a list of diseases. So if there's a woman who, suffers from that and wants to make sure that her progeny does not, we have that option. And similarly, PGTSR is a technique which screens for chromosomal rearrangements, which can increase the risk of miscarriages, for example, in the pregnancy. Embryo freezing. So embryo freezing, any embryos that have not been transferred. So let's say somebody comes in, we've selected the best, we've done a fresh transfer, and we've got a couple more which have developed into good blastocysts. They will be frozen for you as spares. So only 1 in 4 couples kind of reach that situation. So if you find yourself in that situation, that's a bonus. This also includes embryos that were biopsied and all embryos for people who are not planning to undertake any embryo transfer. So sometimes we may have a same-sex male couple who wants to create embryos and preserve them so that they can then use it in a surrogacy cycle. So yes, embryo freezing is a very prevalent option, and we do quite a lot of embryo freezing. Right, so continuing on the pathway, we've done the embryo transfer, you continue your progesterone support in the form of PES freeze, in the form of injections, and then around approximately 2 weeks down the line, we get you to do a urine pregnancy test at home and give us a ring. And yes, if it's a beautiful, strong positive, we then bring you in for a scan in our clinic at 7 weeks, which is where we want to see the culmination into a lovely pregnancy intrauterine, and you can see a nice little yolk sac with a fetal pole with a nice thumping heartbeat. And I love this picture. We can also show you a fantastic picture on a 3D scan. Once we've done that, we also have the option. So once this is achieved, we kind of say goodbye at this point and we send you down the antenatal route via the NHS. But you do have the option of booking another 10-week scan with a non-invasive prenatal testing, which is a very accurate test to look at certain genetic or chromosomal issues like Down syndrome. Right, so that was IVF, ICSI and PICSI cycles. What else do we do? So we also offer egg donation and sperm donation procedures. Egg donation can be undertaken either because of, women who either because of age have lost most of their eggs and would now like to use donor eggs. Some women are go through early menopause and therefore require egg donation. They may have undergone chemotherapy, which has got very devastating effect on the egg numbers and the egg quality. There are those who are born without ovaries. There are certain conditions, and of course, if I've got a heterosexual couple or sometimes same-sex male couples, they require donor eggs as well. Moving on to sperm donation. So sperm donation may be utilized either by individuals or couples where there is no sperm production because of a genetic issue. It could be the same thing. Chemotherapy has destroyed the sperm production. It could be sperm production affected by genetic conditions. It could be a single lady who wants to use donor sperms in in an IUI cycle or an ICSI cycle, or it could be same-sex female couples using donor sperm. So yes, sperm donation and egg donation are quite sought after, and our clinic offers these services. Surrogacy is another modality of treatment, with more than 374 surrogacy cycles completed since 2012. Our clinic is one of the leading clinics in the country offering surrogacy. We've got a dedicated surrogacy team. And a surrogacy, basically, for those who probably don't know much about it, is where a set of parents want to borrow a womb. Okay, so we call that set of parents intended parents, and the woman who is going to lend her womb, to put it in a very lay term, is called the surrogate. Many cycles also include egg donors. So like I mentioned, if you've got male same-sex couple, obviously they have to use their sperms, use donor eggs, create the embryos, and then transfer it into a surrogate. Okay. If it's a heterosexual couple where, you know, the woman can provide her eggs, the male can provide the sperms, create the embryos, and that can go into a surrogate. And this may be situations where the woman probably doesn't have a womb, for example, or she may not be producing a thick enough lining, or sometimes we even have couples where carrying a pregnancy might be life-threatening for that woman. So surrogacy does play a very important role in a lot of these situations. There are two types of surrogacy arrangements. We've got the host surrogacy, which is the one which is usually utilized, where there is no genetic connection between the host and the embryo which goes in. Right. So what about funding? So our clinic does offer a lot of NHS funded fertility treatment. Okay, how to access? So we are in partnership with 3 ICBs, the Mid and South Essex, North Central London, and North East London. So your ICB, you got to remember, your ICB is determined by the location of your GP and not your home address. So if you're confused, if you think, no, I'm eligible, if you need more information, please visit our NHS webpage. As mentioned here. So just to give you a bit more detail, so North East London ICBs include Barking, Dagenham, Havering, Redbridge, Waltham Forest, City and Hackney, Tower Hamlets and Newham. Mid and South Essex will include Mid Essex, Castle Point, Basildon, Brentford, Thurrock and Southend. And the NCL includes Barnet, Camden, Enfield, Haringey, and Islington. So if you find that there is no NHS funding, or for some reason you don't qualify for the NHS option, could there be some other ways? Yes, there are. So we do have programs called Egg Share Scheme and Sperm Share Scheme, so whereby you can actually subsidize your treatment cycle. So I'll give you an example, and you can get more details by getting in touch with us. So if there is a young lady less than 35 years of age with a certain level of AMH, making sure that she's got adequate wear and reserve, she can have, she could approach the clinic to say that, yes, I will undergo an IVF/ICSI cycle, and whatever number of eggs I get, the mature eggs will then get divided. Half stay with me for my own treatment, half will be donated to the bank. So you're doing a good turn, and in return, getting a subsidized treatment cycle. And similar sort of option is available for sperm sharers. So if that is something which piques your interest, please get in touch with us and we will give you more details regarding this. And here comes the offer. So we've got a special offer for this month. So if generally our new consultations get booked at a price of £250, but if you are able to, or if you would like to book it by 9th of May, you'll get a 50% discount. So the discount price is £125 for the consultation. Remember, it does not include the bloods, which is AMH, thyroid functions, or the semen analysis. Right. So in addition to the fertility, the funding options that we've discussed, we also partner with a couple of other bodies. Access Fertility is one of them, and Assured Fertility. So if you think you would like to get into some sort of a package arrangement, do visit these 2 funding bodies and have a look and see if that is something which takes your fancy. We also have an excellent finance team. So if there's anything you don't understand, please pick up the phone and speak to one of them, and they will be more than happy to help you navigate this process. Okay. Wellness at Herts Essex is extremely important. Emotional support provides protection against internal and external factors. You'll find a lot of resources on our website, but more importantly, you'll find that when you go through this journey, every individual is invested in this journey, and we feel we don't promise that every couple, every individual walking through the door is going to go away with a baby, but we want to make sure that we make this arduous journey as pleasant as possible. So yes, you will find a lot of wellness and support being provided in this clinic. We collaborate with the associations of the UK dietitians, and we've got a dietitian on the team as well. So if that's something you would want to look a bit more into, please get in touch. So brings me to the end of this presentation. Why us? There are lots of clinics everywhere. Why us in particular? Well, we've got over 35 years experience. We've got 7-day-a-week laboratory service. As I mentioned earlier, we provide embryo transfers all 7 days. We've got an excellent electronic witnessing system, which ensures there is no mixing of gametes whatsoever. We've got more than 8,000 lovely babies to our credit. You will find yourself supported throughout the treatment. And of course, there's free parking. One more thing, we are located, although, we're just outside London, so very much reachable. We are just off M25, very closely connected with A10, M11. So yes, it's a good location. But at the same time, it's not bang in the city. You'll find it's in a very beautiful location. We've got a lovely canal side running alongside. We've got ducks in there. So yeah, what more can you ask for? But thank you so much for having stayed with me. We value your feedback. I'm sure you've been sending us questions, and I will join Jackie and Marna once I finish the presentation. But yes, Marna would have sent you a link. So please do give us some feedback. Positives, negatives, extremely important. We will take those and try and improve these open evenings even further. Follow us on social media, and Mana just reminded me to remind you that we have just launched on TikTok. So those of you who are on TikTok, follow us on TikTok. So if you want to book an appointment, again, we'll send you some details, but you've got this number. You can drop us an email on enquiries@hertsesexfertility.com. As I said, book those consultations. New consultations usually are available within 6 weeks. So hopefully you've kept those questions coming, but please don't go away. At the end of this, I will share a link, and that will give you a little tour of our clinic. But once again, thank you very, very much for joining us for this open evening. I hope to see a lot of you in person in the clinic soon. Thank you and have a lovely evening. Sorry, just give me a moment. I am going to share it again. Here we go. Thank you.